Welcome back to Get Connected. I'm your host, Con Jackson. We're coming to you from the Caribbean. That's right, we're here in Cartagena, Colombia, celebrating its 200th year of independence, and the dancing and the style all await us in just a moment. But first and foremost, it's time for Health Beat, and for that we're returning back to America to talk about a subject matter called rheumatoid arthritis, and look who's just showed up. But the next TV star. Well, you want to keep healthy so that you can come and enjoy a location like this. And Dr. Wells and Glenn join us now.
Hi, Con.
Hi, Con.
Well, first, Glenn, let's start with you. What symptoms were you feeling that finally led you to go see a doctor?
I've been diagnosed with rheumatoid arthritis for about 5 or 6 years now, and I had symptoms before that diagnosis for 4 or 5 years before that. And the symptoms I were having, I really didn't connect that was pointing to a specific disease. I had difficulty using my hands, simple things that you do every day, opening a door, opening jars, using my cell phone. Of course, I had pain in my hands and feet and fatigue that went along with that, but I didn't put it all together for a diagnosis.
Well, doctor, we're certainly glad to have you with us, but tell us, clinically speaking, what is rheumatoid arthritis?
Rheumatoid arthritis is what we call an autoimmune disease, and that essentially means the body begins to turn on itself, attacking the joints, the bone, and the cartilage. And there are over 2 million patients in the U.S. that has rheumatoid arthritis, and one group that often gets overlooked is a group that what we has moderately active disease. And these are patients might only have 2 or 3 swollen or tender joints. And I stress that because at 2 or 3 joints in an individual patient could be a huge deal. Let's say if you have a carpenter who has swelling and pain in the wrist, or you have a young mother swelling and pain in the elbow, those few joints can have a huge impact. The goal now is to get that patient to a rheumatologist so we can make the diagnosis and get them on appropriate therapy to either slow or halt the disease.
You know, doctor, once someone is diagnosed, what are the options they have going forward?
And just like what Glenn alluded to, this is why we focus on the communication. I need to know if a patient is having pain, if they're having stiffness, or if they're having difficulty doing their things. You know, like Glenn alluded to, things like fastening, buttoning your shirt or putting on your socks. Those things are patients often take for granted, or we as physicians do, and then want to address those as patients get them diagnosed and get them treated. So we use laboratory tests, we use imaging tests like x-rays to help make the diagnosis and to get them on appropriate therapy for that individual patient.
And doctor, do we understand the why yet? Why someone gets the disease?
You know, unfortunately we don't. That'll be a Nobel Prize one day when somebody discovers that. But we do know now that we can actually halt or slow the progression of the disease. There are a number of different drugs. Some are pills, some are injections, some are infusions. But we have a number of different agents now. And I tell my patients it's never too early and never too late to get to the rheumatologist who can help you get your disease under control so you can have a more normal life.
Well, speaking of normal life, Glenn, tell us where you are in your treatment.
I have had a combination of medications over the years that have been changed, and at the point where I am now, my disease is well managed. I'm much more active. I walk outside a lot. You know, I have the energy and a lot less fatigue, and you know, to be active throughout the day. So I really do want to encourage patients to you know, be confident in telling their doctor what their symptoms are, and then you can have that assurance that a chronic disease is being managed as best it can.
Well, Glenn, it sounds like you're on the right course. And doctor, where do people usually feel rheumatoid arthritis first, and where can we go to learn more about it?
Yeah, so the joints we focus on the most are the small joints of the hands, but it can also affect the feet as well, and it's usually on both sides of the body. One nice resource we put together, we've partnered together with Amgen and Pfizer and developed a website called InsideRA.com that tells you what are some of the signs and symptoms you look for. You know, how do we make the diagnosis? What are some of the treatments? But most importantly, what things can a patient do to help increase the communication between the patient and their physician?
Glenn, if someone is just now diagnosed with rheumatoid arthritis, what would you want to say to them?
I would encourage patients to talk with their doctor and to communicate with the office staff. It really is quite a team in managing the disease, and it really is helpful for that information to be going back and forth, and for a patient to ask questions and and to really ask if they don't understand either their diagnosis fully or the potential side effects of their medications.
Glenn, thank you for your advice. Doctor, as well, thank you for your passion for this subject matter and making us more aware.
Thank you.
You're welcome.
If you want to see other Health Beat segments, you can log on to our Get Connected website at contv.com. It's now time to head on that yacht over to Cartagena, where they're celebrating their 200th anniversary with salsa, spice, and all kind of good things that make life more colorful and enjoyable. Stay tuned. Thank you so much for watching. Are you tired of negative news? We are.
And that's why we're creating a movement.
By keeping it real.
With what you need to know. It's more than what's happening.
It's bringing hope back to our lives.
So go to contv.com and join our movement.